Do you have pain in your shoulder, especially when you try to just raise it up like this and you feel that point right there that hurts a lot? Well, you might be suffering from shoulder impingement syndrome. Shoulder impingement syndrome many times is caused when you keep your shoulders too far forward, if you've got bad posture, if you're working at a computer with your arms forward, if you're using repetitive movements that compress the joint, if you're lifting weights and you have too much forward workout and not enough workout for the back of your shoulders or the scapular muscles to bring your body back. So an impingement of the rotator cuff muscle called the supraspinatus is what's causing this problem. So first thing that we want to do is we want to alert our patients to the proper posture to try to get their shoulders to roll back instead of rolling forward, because that is many times what's causing the problem. We're also going to find where the tendon is exactly being impinged, and we can take our fingers and get right on that tendon, and we could do a cross fiber movement right on it. How's that feel? Not too good, huh? You want me to stop, right? Well, I'm not stopping right now, no. But anyway, so we're going to do that to try to break up the scar tissue in the tendon. So another way to test for this is what we do is we take the arms from at the side at about a 30-degree angle, right? And we have the patient try to push against me, so push against me. And so if they're weak like that, that means that they may actually have a partial or even a complete tear. We don't want a complete tear, that's not a very good thing. But if we have a small tearing, we still might be able to help you. So there are certain exercises that we do for rotator cuff. And one of the exercises we do is have you lie on your side, Christian, is we'll have the patient take a dumbbell with their arm perfectly straight, and we'll start with maybe 1 or 2 pounds and have them bring their arm up just about 30 degrees like this. And we'll have them work up to 10 repetitions and maybe then up to 15 repetitions, and then increase from 1 to 2 to 3 sets of that, all right? So this is the abduction movement that the supraspinatus is responsible for. Another movement that we like to try to get them to do is called external rotation. External rotation is also helpful, and there are muscles, the infraspinatus and teres minor, which contribute to that movement. So when we do the external rotation, we'll have a dumbbell, and we'll have them come up and try to keep their arm tight against their chest and make sure that they don't roll back. So I'm going to stand behind him here and prevent him from doing this. So we'll start with 10 reps at the weight that he can do for 10 reps, and he starts getting tired at 8, 9, and 10 reps. That's the right weight, that's how you know. And we'll come up and do 10 of those, all right? And then when we have him lie down on his back, we can have him take the dumbbell, and we want to raise him up maybe just like that. We don't want him to come too high, because that's going to create that impingement. So we can just activate the front of the shoulder by just coming up about 30 degrees with a light weight. Something that you can do for relief for this condition is to have your arm dangling at your side to try to open up the shoulder, to try to decompress the joint. Another exercise group that we like to do, put your legs over here, is we want to work on the muscles behind his back. So we'll have him do low row exercises, just like this. Low row exercises. Then we'll have him stand up, please. We'll have him stand up, and we'll have him take dumbbells or bands, which are tied to a fixed object on the wall, and we'll have him bring his arms back and squeeze his shoulders. So again, what we're trying to do is bring his shoulder blades back. So we have the low row exercise, and then we have the straight arm extension, just like that. Keep your head over your shoulders when you do that, and that's going to help to bring the shoulders back. And if he wants to bring his arms up a little bit here, we don't want to come too high. We don't want to pinch it. He can do a row up here too. As long as he's not having any pain with this, we can do keep your shoulders down when you do that. All right, so those would be some examples of exercises that we can do to strengthen the muscle behind the shoulders. So if you have shoulder issues and you'd like to see if you can get better, it'd be a great thing to have us help you. We'd love to do that.